Welcome to Transitioning to Medicare Part 1. My name is Lois Romeo, and I'm representing the SHIP office, the State Health Insurance Assistance Program. We're here to be local help for you at no cost. We're unbiased. We don't make any money off this. It's no cost. And they're trained counselors. So we have one full-time employee and the rest are volunteers, but we are trained and we do have to take tests to show that we know what we're talking about. We can give you education. We can give you one-on-one counseling. Those are done by appointment. And then we can do things such as a benefit program review. That could be benefit program of a Medicare program, or if you're trying to compare like a retiree program to Medicare to see which makes more sense for you. We also can give you application assistance and look at problems with you. So we're available to all Carroll County residents, but there are SHIP offices all across the country. This is the list of the other counties, just in case you have friends who go, wow, how do I get help with that? You can give them these phone numbers for their counties. And if they live in another state, they can look it up on www.medicare.gov and they'll find the SHIP office closest to them. So Medicare, most people think of Medicare as health insurance for people over 65, which it is, but it's also for people under 65, anybody that has end-stage renal disease and certain disabilities can qualify for Medicare. It was originally came about in 1965, and in 2020, there were 62.8 million people on Medicare. And that's expected to grow to 80 million by 2030. So if you have trouble getting through to Central Medicare on any given day, it's because there are 10,000 people enrolling into Medicare each day of the year. Part D, prescription drug benefit, didn't come about until 2006. So how do you go about enrolling in Medicare? Most of you would be enrolling through the Social Security Administration, which confuses people. So you come in through Social Security Administration, or if you're a retiree from the railroad, you come in through the Railroad Retirement Board. So the enrollment comes through those organizations, the administration of Medicare. So once you're actually enrolled, the administration of it is what occurs through CMS, or the Centers for Medicare and Medicaid Services. It can be automatic. You might not have to do anything. If you're already receiving a Social Security check or a railroad retirement benefit, then enrollment in Medicare is automatic. So what'll happen, you'll get a package in the mail, and that comes in it's called your initial enrollment period package. It's mailed 3 months before the month that you actually turn 65. Or if you've been on disability, it's going to come on the 25th month of disability benefits. It does include your Medicare card. So as you hit these cycles, you're going to see lots of things that look like that envelope you're seeing here. A lot of them are ads that you can just throw away if you want. But first look at it and make sure your card is not in there, because we've had that happen with folks. If you're not already receiving Social Security benefits or RRB, then you have to proactively enroll in Medicare. You can do that online at the Social Security Administration, again, www.ssa.gov. You can contact your local Social Security office, which is in Westminster, and there's the phone number. They would be doing it, excuse me, by phone. They are still not meeting in person in the office. If you're a retired railroad worker, then you're going to enroll through RRB, and that's your phone number for the local office. So when would you enroll in Medicare? That initial enrollment period is 7 months. It comes 3 months before you turn 65 through 3 months after you turn 65. What this chart is showing you is if you enroll in that 3 months before you turn 65, then the first day of the month you turn 65, your Medicare will be effective. If you wait till the month you turn 65 or later months, you will have a delay in when your coverage starts. There are some other times you'll be able to enroll, but some of them you would have a penalty if you delay, and we'll talk about those circumstances. There are 4 parts of Medicare. Part A is hospital insurance. So that is when you've actually been admitted to the hospital, and it's that inpatient hospital care. If you went from there to a rehab center, a skilled nursing facility, that would be under Part A. Some parts of home health care are under Part A, and hospice care is under Part A. Everything else other than your drugs pretty much falls under Part B medical insurance. So when you think medical insurance Part B, that's your doctors, your labs, your x-rays, your chemotherapy, your dialysis, everything like that, even your durable medical equipment such as wheelchairs. That all outpatient surgery falls under Part B. Part D is the newest part, and that's the part that has your Medicare prescription drug coverage. And then Part C, and yes, we know how to do our alphabet, but there's a reason we put it over on the side, and that is because it's an alternative way to cover your Medicare. That will include Parts A and B, and in most cases will have a Part D coverage under it. So one of the books that's very useful, and it will be in the links that you have when we send these out to you, is Medicare and You 2022. This is a book you'll receive every year once you're enrolled in Medicare, and that will tell you what does Medicare coverage. And in that list of coverage in pages 30 through 56, if you look for the little blue apple, that's going to tell you which things are preventative services. And those are covered at no cost from doctors who accept Medicare assignment. That also is available, that book is available online at the Medicare.gov site. This is just a reminder, you should go out and get your flu shot every year, and we'll see what happens with COVID, but if you haven't gotten a COVID vaccine, go ahead and do it. In your book, it describes the coverage for COVID, but it is not going to cost you. And so you want to stop the spread. This is a more extensive list, and this is a page right out of the book, Medicare and You, that tells you what's going on and what the coverage is while we are under that public health emergency. Once that changes, there could be some changes to this coverage. But for now, and while we're still in that public health emergency state, this is the coverage, which is pretty much everything. But this gives you the details. So now we're going to talk about the ways you can get your Medicare coverage. You can have either original Medicare or Medicare Advantage plan. You can be on one side of this chart or the other. You can't cross over between the two sides. So original Medicare, a lot of our people in Carroll County are under original Medicare. Original Medicare, you can go to any facility, any doctor that accepts Medicare, that it treats Medicare patients, and that's most of them. If you decide to do original Medicare, we're going to go through what the costs look like on that. You can decide to pick up a supplement insurance or a Medigap, which will pick up some of the co-insurances and deductibles that you would pay under original Medicare. On this chart, Medigaps, Part D and Part C's, the Medicare Advantage plans, are all run by private companies. They're regulated by Medicare, but they are private companies, and therefore there will be some different pricing going on in those. Under the left-hand side of this chart, you have a pretty predictable flow for people that are retired and on a fixed income. That can be attractive. You're going to pay your Part B premium. You'll pay a premium for the Medigap if you can afford to pick one up. And then we can tell you what your Part D is going to cost you. Some people find a Medicare Advantage plan more attractive. That's a little more like what you've been used to in an employee coverage. It includes your Part A and B, and most of them include a Part D within it. It will have a network of doctors and facilities, and it's going to be either an HMO, PPO, or we'll talk about something else called an MSA. In an HMO, if you go outside of that network of doctors, you have no coverage. With a PPO, you can go outside that network of doctors, but you're going to pay more than you would in network. But there are some advantages, such as if you are on the left-hand side of this chart and cannot afford a Medigap, you have no upper limit of what you could spend out of pocket on your deductibles and coinsurances. Under a Medicare Advantage plan, you will have some upper limits, which we'll talk about. And we'll do most of that discussion next week when we do the part 2 of this. The other thing that's an advantage for folks under Medicare Advantage is there are some services that are not covered under original Medicare. So you have some options to pick up vision, dental, and hearing. So just your normal checkup and getting a pair of glasses, for instance, is not covered under original Medicare. A medically necessary surgery will be covered, such as cataracts. But if you choose to do a repair astigmatism at the same time, that's not medically necessary. That's an option you've picked. Under original Medicare, that portion of that surgery would not be covered. So there are, again, some options you can get under Medicare Advantage plans. So you've got some decisions to make right up front. Should you keep or sign up for Part A? For most people, it is premium free. And that's if you or your spouse have worked for 40 quarters and paid into FICA. Then you do not pay a premium for Part A. You contact Social Security and you sign up. The main people that might not want to sign up for Part A would be if you have a health savings account. So once you have any portion of Medicare, you are not able to contribute to an HSA tax-free. You can use the funds you've already put in there, but if you continue to contribute to that, you will have a tax penalty. So some people who have an HSA choose not to sign up for Part A. Part B is a little more of a question. So many people will delay Part B if either you or your spouse is actively employed and have coverage through your employer. You do need to check with your HR department, though, to find out how your current coverage works with Medicare, because there are some employers that do require you to have Part A and B once you are 65 or older. So you don't have to sign up for Part B. There's no penalty associated with it if you enroll within 8 months of losing coverage through active employment. So most people don't do that because they want continuous coverage, but you have that leeway. If you are not considered medical coverage from active employment, if you don't have that, you're going to normally want to sign up for Part B. Folks that are retired federal employees that have FEHB, there's some further assessment you may want to do. And then the second thing is, if you delay Part B, you can be in a position of paying higher premiums or paying for your healthcare out of pocket. Coverage based on current employment does not include COBRA, retiree coverage, VA coverage, or individual healthcare coverage, which is through such as the health insurance marketplace. So in those situations, if that's what you're covered by and you delay your Medicare for any of those reasons, and you don't sign up within the allotted time frame, you will most likely be charged a penalty. So this gets a little complicated, but it's in most cases, once you're on Medicare, then if you are, for instance, if you're on a retiree program, Medicare is going to pay first. If you're 65 or older and your health plan and coverage is based on you or your spouse's current employment, if that employer has more than 20 employees, then your group health plan is going to pay first and Medicare is secondary. However, if they have fewer than 20 employees, then Medicare will pay first and then the group health will pick it up. If you're under a disability, that number of folks that are in that category have to be 100 or more employees. So if there's more than 100 employees and you're on there and you've got disability and you're under 65, your group health and plan is going to pay first. But if they have fewer than 100 employees, Medicare is going to pay first. So end-stage renal disease is unique. If you're on there, a group health plan, and you have Medicare because of end-stage renal disease, then your group health plan is going to pay that first 30 months after you became eligible to enroll in Medicare. After that, Medicare will pay first and your group health would be secondary. If you have Medicaid, Medicare pays first. So the question is, should you keep or sign up for Part B? Well, sometimes you have to have a Part B. So if you want to buy a Medigap, you have to have Part B. If you want to join a Medicare Advantage plan, you have to pick a Part B. If you are eligible for TRICARE, that is an employer who requires you to have both Part A and B. And other employees, and that's why you talk to your HR, if your employee coverage requires it, you have to get it. So some folks who are eligible for veterans healthcare benefits choose not to get Part B. They're in a little bit of a unique position. If you have a veterans healthcare and you have Medicare, you can choose to use either your veterans benefit or your Medicare. You can't use both of them for the same treatment. Some people will do their veterans health benefits for their drugs, for instance, and do most everything else under Medicare Part B. But if you believe you're going to do all your health care through Veterans Administration, you may choose not to pick up a Part B. So just remember, you could have a penalty if you sign up late and if you're not covered with active employment coverage. So how do you enroll in Part B? So if your card came out to you, you can make some choices. So first off, you can enroll in that initial enrollment period, the 3 months before you turn 65 through the 3 months after you turn 65. You can also do it within 8 months of retiring from active employment or your spouse's active employment. If you miss those cycles or a special enrollment period that we'll talk about, then you have to go through general enrollment to pick up Part B. And you can only do that from January 1st through March 31st of each year. And in that situation, your coverage does not begin until July 1 of that year. You will also have a late penalty, and that would be 10% of the premium for every 12 months you were eligible for Part B and didn't pick it up. So, that can add up pretty quickly. You don't really want to be in that position. So when your Medicare card comes to you automatically because you're already on Social Security or RRB, then you can keep it and accept Part A and B. On the other hand, you can follow the instructions on the card if you really only want Part A right now, and you can refuse Part B. If so, you're just going to follow the instructions and return the card. They'll send you a new one with the Part A on it instead of A and B. So what does it look like when you're on original Medicare? If you go to the hospital, meaning if you're admitted to the hospital, you'll notice on this that it is premium free. If you're admitted to the hospital, you have a deductible per benefit period of $1,556. So that you owe automatically when you're admitted to the hospital, unless you have other coverage that picks it up. After that, you have 60 days of hospitalization coverage. And in that benefit period, and then you start paying some co-insurances, $389 per day for the next 30 days. And then if you were in a benefit period in the hospital, had more than 60 days of hospitalization, more than 90 days of hospitalization, then you can start working against something called your 60 lifetime reserve days. You pay a higher co-insurance, but you can have over your lifetime, up to 60 more days of coverage. If you're admitted for at least 3 full days, and they're required to tell you, so for instance, some of you might go into the emergency room and you're still under observation. Even if you get moved to a room, sometimes you're still under observation. But in the first 24 hours, they're required to let you know whether you're under observation or whether you've been admitted. So if they don't tell you, make sure you ask about it. If you've been admitted for at least 3 full days, not the day you get discharged, and then had to go to a rehab center, a skilled nursing facility, then you have 20 days of coverage. After that, again, you start paying some co-insurance. This is per benefit period. So the way that's defined is the last time you got out of either the hospital or the skilled nursing facility, if more than 60 calendar days have gone by, then you start a new benefit period. So that says you can have more than one benefit period in a calendar year. If you start a new benefit period, you pay that 1556 again, and you start your day count all over again of your hospitalization days. So to give you an example how that works, if you went in and out of the hospital in January and used maybe 5 days of your hospitalization, and did the same thing in February and did the same thing in March, hopefully you won't, but if you did, you are still under that same benefit period working against those 60 days of hospitalization. However, if you went in and out and spent 5 days in the hospital in January and you didn't go in again until April, now more than 60 days have gone by since you got out of the hospital. That says you start a new benefit period, even if all you've only used are 5 of those 60 days you were eligible for in that last benefit period. So can happen more than once in a year. Medical insurance, the Part B, on the other hand, is run on an annual basis. There is a standard premium for Part B of $170.10 per month. It can be income adjusted, and I'll give you a chart near the very end that explains that. But if you make over certain amounts, you might pay more than the $170.10. And that comes right out of your Social Security check, unless you are not yet taking Social Security benefits. Then you would get a quarterly bill for 3 times that amount that you would end up paying. There's also a Part B deductible. So the first $233 you spend on doctors, labs, whatever, that are Part B services in that calendar year, you will be responsible for. After that, Medicare is going to pay 80% of the bill. You're responsible for 20% if you don't have other insurance. That's unless you go to a doctor or facility that does not accept assignment. They can charge up to 15% higher than Medicare's allotted for its figure. So they still have to work off the amount that Medicare would pay for that, but they can do 15% above that. So if you had a bill for $200 and Medicare pays $100, under normal circumstances, if you go to someone who accepts assignment, Medicare is going to pay $80, you're going to pay $20. If you went to someone who did not accept assignment, then Medicare is still going to pay the $80. You would pay the $20 and the $15 extra that would be charged in that cycle. So having seen some of those amounts of money that you might be paying, that's what actually has people look at Medigaps or supplement insurance, because that supplement insurance can act as a safety net to pick up some of those costs that you would have normally. So what is a Medigap policy? You'll hear it called supplement, secondary, Medigap. All of these are sold by private companies. They're administered by the Maryland Insurance Administration. So they review them for fiscal responsibility, et cetera, and they have to follow certain rules. But they all do their own costing. So if they pay out more claims than expected, they can get an increase approved. So they're designed to fill the gaps in original Medicare. And when we say gaps, that's not meaning additional medical services. What it's talking about is the financial gaps. So they're designed to allow you to pay a premium and then have some of your deductibles or co-insurance covered. They are standardized plans. So every plan that has the same letter has the same coverage, even though from company to company, you'll see differences in cost. So the question is, do you need a Medigap policy? Well, some people don't need it because they already have supplement coverage, and they have it from one of multiple sources. They might have it from a retiree program as a former employee. They might have TRICARE, might have veterans healthcare benefits. Most people that have worked for state government of any type, really, state, city, county, federal, usually have some good retiree programs, and that acts as their secondary. So you probably don't need a Medigap in that case. You can look at it and see what those are costing you versus Medicare, but you probably don't need a Medigap. The other question is, are you comfortable just paying those co-insurances and deductibles, which you might decide you are. So what are the Medigap plan types? So just to see how this chart is arranged, if you look down the benefits, the left-hand side, you'll see those co-insurances and deductibles we had on the earlier chart. If you go across that row, you will see that if there's an X in the column, it means that that particular plan type pays for that particular item. So just to give you an example, you'll see that Plan A, Medigap type, does not pay that $15.56 if you were admitted to the hospital, whereas all the others either pay for it or pay a portion of it. So that's how you read this chart. If you were born before 1/1 of 2020, there were also some other plans that were available. So if you're in that category, you can talk to us. There was an F, an F high deductible, and a C. But if you were born after that, then you will not have coverage in any Medigap you pick for the $233 Part B deductible. You'll see there are no X's in that row. So, but that's just across the board. So the most commonly chosen plans these days are G and M. G is going to be your highest premium each month, but you'll see, other than the $233 that you pay for your first labs and doctors, etc., in a year, they're going to cover all the other co-insurances and deductibles. So, if you have multiple iterations of benefit periods in the hospital, it's going to pay that $15.56 each time, right? So G is going to be the highest premium, broadest coverage. N is fairly similar to a G. It is going to have a lower premium, and you'll notice the asterisks by the 20% B coinsurance. And if you look at the footnotes, what that's letting you know is if you pick a plan N, you will pay that first $233, but the asterisks are letting you know that you also would pay up to $20 for a doctor's visit and up to $50 if you go to the emergency room and you're not admitted. So that looks a little more like a lot of your employer coverage sometimes that you've had. You also, if you go to a doctor that does not accept assignment and you get charged that extra 15%, you will not have that covered. You would be paying that out of pocket as well. But all the other things you'll see an X in the column are covered. A plan that has become more popular as more and more people have 401ks and that type of thing is a G high deductible. And you'll note on the bottom this, what that means to you. So it basically is giving you a much lower premium, but it is giving you what you would think of as catastrophic coverage. So what happens in a G high deductible is you would not only pay that Medicare Part B deductible, the $233 in a year, you would also in 2022 pay up to $2,490 in coinsurances and deductibles. Most people aren't going to hit that, unless they have a rough year, right? They go to the hospital. If they're admitted into the hospital in different benefit periods, absolutely you're going to hit that. But usually it would take a major surgery or hospitalizations, to hit that. But once you hit that, you then have the same coverage you would have for any G policy, meaning it's going to pick up the rest of your coinsurances and deductibles. So some people would much rather pay a lower premium up front and maybe even put the money aside that they would have spent on that premium to cover if they have to pay some coinsurances and deductibles, and then know that there are some years that they're going to have to pay that out of pocket. So Medigap Plans is a very important concept called guaranteed issue rights. And the reason that's important to you is that is when you can purchase a Medigap without any medical underwriting. So that says they can't ask you medical questions and you look the same as any other 65-year-old. if that's when you're going in. And it doesn't matter if your health is terrible or your health is good, you're going to be quoted at that same rate. So when do you have those guaranteed issue rights? That's the first 6 months you're 65 and have Part B. This is one of the big reasons, two main reasons people will delay Part B if they have active employer coverage. They don't want to be paying that Part B premium when they won't get much use from it. But the second thing is not picking up Part B protects your guaranteed issue rights. The other folks that have it are the first 6 months when you're under 65 and you have Part B due to a disability or end-stage renal disease. Same situation. That's when you can pick up a Medigap and have guaranteed issue rights. If there's some other conditions where you would get not 6 months, but 63 days. So if an Advantage plan or active employee group plan ends, then you can, you have 63 days of guaranteed issue rights to pick one up. So how do you find the right policy for you? You can go to one of two websites. You can either go to medicare.gov or you can go to the Maryland Insurance Administration site, which is listed here. For most of you, it's going to be more useful to go to the Maryland Insurance Administration site. And the reason being that that will list not only what companies you can get a Medigap from and what types they cover, but you will see your annual premiums, which is what most people obviously want to look at. So highly recommend that you go to the Maryland insurance site. So the other part, so the two parts that you can be penalized under original Medicare or under Medicare as a whole, if you do not have when you're supposed to pick them up, are Part B and Part D. Part D is prescription drug coverage. Again, you would not have to pick that up if you have creditable coverage through an employee plan. So if you're picking up a Medicare prescription drug coverage, you have to have either Part A or Part B to be able to pick up a prescription drug plan. You are not automatically enrolled in Part D in any situation. You have to actively enroll yourself to join it. You can delay enrollment with no penalty if you have that creditable drug coverage. And that could be either through you or your spouse's active employment. All that means is your employer coverage is equal to or better than what you would have under the Medicare Part D plan. Companies are required, once you're turned 65, to make you aware that your drug plan either is or is not creditable. You'll get a letter each year, and make sure you hold on to those in case you need them as proof in the future. So when can you enroll in Part D plan? You can do it during that initial enrollment period again, those 7 months around the month you turn 3 ahead, 3 after the month you turn 65. You can look at it each year in the open enrollment period, and that is from October 15th through December 7th each year. When you sign up in that cycle, your coverage begins January 1 of the following year. So that is something we recommend you do every year because your plans will change, etc. Your drugs may change, all of the above. So there are some other times you can join. So if you lose employee or retiree creditable coverage, then you would join within 63 days of losing that to not hit a penalty. To not hit a penalty. Otherwise, there is a penalty of 1% of the base rate for each month you did not have Part D. So, it's something you don't want to be paying because these penalties on B or D, you pay for the rest of your life. So that's why you want to pay attention to when you need to have enrolled. And if you have questions, just contact us. We can help you understand it better. If you enroll at some period other than open enrollment, the coverage will always start the next month. So the first of the following month. So you do have creditable prescription drug coverage if you have employer union health coverage, COBRA, Medicaid, FEHB, veterans benefits, all of these that are listed here. Do hold on to that proof that you have that though. And that way, if you join a Medicare drug plan later, you have the proof that you had creditable coverage throughout that time period, and you won't be subject to a penalty. So what are you going to pay for your Part D prescription drug plan? In 2022, actually, you are going to pay a monthly premium, and that's going to be your plan premium. That could be a base price and an income adjustment, just like we talked about on Part B, and it may include penalty if one applies. You will have a yearly deductible, and that can be up to $480. It's one deductible across the year. And then you will pay for the drugs that you pick up. And that's when you go to pick them up, anything that's on your plan's formulary, you're going to pay a copayment or co-insurance. And if you look at preferred pharmacies, that's going to be less expensive. Some of them, by the way, depending on the plan you pick and the drug you pick, may have a zero copayment when you pick it up. Just one more point on that, which is how the deductible gets applied is going to depend on the kind of drugs you're on. If you're on a very expensive drug, you may be paying that as a lump sum right up front the first time you fill that drug prescription. If you're on tier 1 drugs, generics that are preferred, you may never be affected by that deductible. So it can vary significantly in how it's applied. In 2022, the donut hole is calculated. You've heard about this from other people. You've also probably heard that the donut hole went away. It didn't actually go away. It just got reduced. So if the total drug cost, if you filled your drugs enough times that the total drug cost, not your cost, but all the people that are paying into it and what the cost is for that, is $4,430, then you fall into what's called the donut hole, and you now pay 25% of either the brand name or generic cost at that point. You stay in there until you come out on this other side where your true out-of-pocket deductible, co-insurance, etc., add up to $7,050. After that, you're in a category called catastrophic coverage. And then you will pay 5% or $9.20 on a brand name, $3.70 on a generic. You will pay whichever is the higher. So if that's a very expensive brand name, you're actually going to normally pay 5% of the cost. A lot of people never fall into this. Most people don't. It's when you're on some very expensive drugs. Things to consider when you're looking at your Part D. You want to go to preferred pharmacies for that particular plan. It means they've negotiated lower prices. You want to look at their formulary. Are the drugs that you're taking, are they on the formulary for that particular plan? Some of them may require pre-authorizations. What that means is your doctor is linking to that plan to pre-authorize that they will fill that particular drug for you. And some of them may require step therapy. The way that works is you might be prescribed a brand name and they ask you to do a generic first. And then you work up if that's not working for you, etc. So all of those, now the pre-authorizations and the step therapy are definitely coordinated with your doctor. And if you've already been through that process of trying a generic and it didn't work, the doctor can work with the plan to get that approved. So how do you enroll in a Part D? First off, you want to compare the Part D plans. The nice part, because this sounds really complicated, I'm sure, is that Medicare has an amazingly wonderful plan finder on Medicare.gov. And that is your absolute best way to figure out what's the best plan for you. You can call us and we can work that plan for you, or you can do it directly yourself. You can call a plan directly, but I don't know why anybody, frankly, would want to do that, because then you'd have to call up to 27 different plans to compare them. And this system does all that for you. You can also call Central Medicare and they can run the plan finder for you. And what would happen is you actually put in your drugs or we do for you, whichever. We put in your drugs, the dosage you're taking, how often you get them. We put where you prefer to pick them up. And normally you would compare 3 or 4 different like drug or grocery stores or whatever that have pharmacies in them, and you can pick mail order. And then we would put that information in, run the system, and we can compare for you and tell you what would be your lowest cost overall, not necessarily lowest premium or lowest deductible or lowest cost of a drug. It's really this system. What's nice about it is it rolls all that together and we're able to see what would give you the lowest cost. And again, look at it every single year. So what is open enrollment? Open enrollment actually runs from October 15th through December 7th of every year. You'll see, I'm sure you get sick of hearing the ads on TV or getting the things in the mail. That is your chance to look at both your Medicare Part D prescription drug plans and your Medicare Advantage plans. And again, we recommend you do that every single year. Your plan, the plans change, your prescriptions change. This is your opportunity to say, wait a minute, I want a different plan. And those plans that you pick in that time frame become effective January 1st. And again, we can do that for you, or you can do it online yourself. So we've talked about original Medicare. Just again, as a summary, you know you're going to pay your $170.10 for your Part B premium every month. If you can afford a supplement, then you know what you're going to pay for your premium there. And once you go through the comparison of the drug plans, you know what that's going to cost you for the year. So the reason so many of our retirees pick those plans in Carroll County is because it's predictable and they're on a fixed income. And they want that predictability of what their costs are likely to be. And particularly, that's particularly true if you can afford a Medigap. On the other hand, some people, as I said earlier, prefer to go a Medicare Advantage plan. So one of the things, that I want to make clear right up front, because this confuses a lot of people, what happens is you go in with your Medicare Advantage plan card instead of your Medicare card, but you're still under the Medicare program. So you still get all the services that Part A and B would give you under original Medicare. And you will still pay that Part B premium, the $170.10 a month. So when you're trying to make your decision about whether to join a Medicare Advantage plan, number one, you do have to have both Part A and B to join. As I said, you still pay that Part B monthly plan premium. They may require, in most cases do, require you to use a network, or they may require you to get a referral to see a specialist. And there will be copays and coinsurances may apply. Some of them give you a 0 on certain things. That information we'll talk about next week. In the second part 2, we'll talk about your actual costs under Medicare, because they vary by Advantage plan. They can include some benefits that are not covered under original Medicare, such as dental, vision, and hearing aid. Whereas your Medigap Act is a safety net to pick up your coinsurance and deductibles under original Medicare, you may not be sold a Medigap if you have a Medicare Advantage plan. You have a different type of protection, but you can't pick up a Medigap. So our Medicare Advantage plans for 2022 are listed on this chart. As you can see, we've got, a selection of choices. Many of them are HMOs. We have less PPOs than we do HMOs. And again, the HMO, if you go outside that network of doctors and facilities, you pay all the costs. And if you are a PPO, if you go outside that network of facilities and doctors, you will pay more than if you stay in network, but you do have coverage. The last 3 on this chart are only for folks who are full benefit dual eligible or QIMBY. And those are folks that are essentially at a Medicaid type financial level. So most of you will not be able to select one of the ones down at the bottom. When are you allowed to enroll in an MA plan? during that 7-month initial enrollment period, during the yearly open enrollment period, that October 15th through December 7th each year. And in that case, you're going to start on January 1. And then there are some special enrollment periods as well, and that we will talk about in part 2. This is just a chart that you can look at to give you some comparison of how original Medicare and Medicare Advantage work with each other, how they compare to each other. This is a generic one, and so the Medicare Advantage options in, for instance, a state like Florida, where there are a lot more seniors that are concentrated, are going to give you much broader and different Medicare Advantage plans than we're going to have in Carroll County. So they might be really attractive in Florida and maybe not so attractive in Carroll County. But this just gives you that broad thought around it. And you could look at this, and when you listen to part 2, you can sort of decide whether this, how you feel about this chart. So one of the things that's very helpful is as soon as you get your Medicare card is to go ahead and create an account. It's your Medicare account. Some people get confused because they've set up a Social Security account. That's their personal information. That is different. That's Social Security. For Medicare, you would have to set up your own account for Medicare.gov. And again, you can't do that until you have a Medicare card. But once you have a Medicare number, you can create that account, and it lets you do all these types of things. It lets you do those drug comparisons with your personal information. You can choose, if you're like me, to look at your Medicare claims and Medicare summary notices online versus getting lots of paperwork sent to you. You can look at things like eligibility. You can see what your Part B deductible is. So all of that you can do right on that Medicare.gov site. If you come in and ask us to help you look at your drug plans, we're going to automatically work with you to set one up if you have not done that yet. But it's very easy to do. So this is the financial assistance possibilities that you have with Medicare. So the first 3 rows are federal programs. If you look across that, the first 3 rows. So if you look across those rows, you will see that they have an income limit and they have an asset test. And again, it depends on whether you're individual or married, but it's looking at your gross income monthly and then your overall assets. If you're confused about income versus asset, so into income go all of your gross incomes. It could be Social Security, it can be a retiree pension. If you've got real estate income, you could have that in there. Any income you get goes into that income limit. The asset test does not include your home, does not include burial, doesn't include your car, but it would look at savings. It's going to look at anything like a 401k. So if you have a 401k, and you're not taking a distribution from that yet, it's only counting in assets. Once you start taking that distribution from that 401k, the amount that you're having distributed to you would count in your income. And then the remaining amount that's still in the asset would count in the asset test. So if you qualify for QMB, Qualified Medicare Beneficiary, most of your medical costs are going to be covered. That's very similar to Medicaid. If you qualify for SLIMB, the next one, the Specified Low Income Medicare Beneficiary, you'll see there's a little higher income limit, same asset limit. That's going to help you by paying for Part B premium. So you wouldn't pay that $170.10 a month. If you qualify for QMB or SLIMB, then you automatically qualify for Social Security Extra Help. So whereas QMB and SLIMB are designed to help on the medical side, Extra Help is designed to help you on the prescription drug side of things. So again, you'll notice it's a little higher income and definitely a higher asset level for the tests. And so some people can qualify for Extra Help even if they do not qualify for QMB or SLIMB. There is one program, the last row, which is State Prescription Drug Assistance Plan or Program. That has no asset test. So we have quite a few people in Carroll County that are on Speed App. You'll see the income limit's a lot higher, and again, no asset test. If you qualify for that, that will pay up to $50 a month towards your monthly premium of your drug plan. So if your plan's $30, it's going to pay $30. If it's $50, it's going to pay $50. The other advantage of this, by the way, that is per individual. So if you're a couple and you've looked at your income and it fits within these categories, you each would put in an application, which we can help you with for Speed App. You each would get that up to $50 per month towards your drug premium. The other advantage of being, if you have Speed App, is that you are allowed one extra switch during the year. Normally in open enrollment, when you pick your drug plan, you've picked it for the year. You cannot change. However, if you have Speed App, you get an extra switch in that year. So that can help if all of a sudden you got on an expensive drug that's not on the formulary of the plan you're on, you might be able to switch to that. There are also other ways that if your drugs are expensive, we can help you look at how do you lower the cost. But this is one thing that gives you a little extra protection. So Senior Medicare Patrol is really trying to look at the fraud and abuse around Medicare. There are billions, tens of billions of dollars each year that are lost due to Medicare fraud and abuse. And you are really the first line of defense against losing that money. So, and we'd all like to keep that money in the program so that we have Medicare coverage for a long, long time, right? So first off, treat your Medicare card just like you would a credit card. Don't leave it laying around. Don't give the number out. Watch for identity theft. Is also, if all of a sudden you see an MSN, your Medicare summary notice, and there are things on there that you don't recognize at all, then you need to pay attention to that and, see if there is identity theft. Be aware Medicare will not call you. They're not going to call or visit to sell you anything. The only time they're going to call you is if you've initiated it. So if you call into Central Medicare and they tell you it's a 2-hour wait, but we can call you back, then you've initiated the call. If it's something other than that and they're telling you it's Medicare calling, just be aware it's not them. It's fraudulent. Hang up. Don't talk to them. You're not going to give that Medicare number out to anybody except your medical treatment folks, your doctors or Medicare providers. And if you come in, for instance, to SHIP and you've asked us to help you, or Central Medicare, and you've asked us to look at this for you. Once you set up a My Medicare account, we can actually do that without even having your Medicare number. So it's another good reason to set up your Medicare account. So we really need you to review those Medicare summary notices. That's what says what Medicare has paid for on your behalf in a given year. So if you see services you didn't receive, or you see something, you go, oh, I saw that the last MSM, why am I seeing it again? Or billed by 2 different doctors or whatever. If you see services that you didn't have, or that you weren't even ordered by your doctor, then what you want to do is you want to first talk to the provider, because it may be as simple as a keying error. Somebody put the number in wrong. But if it's not that, then what you want to do is have your information handy, and then you want to contact your SMP. That can be either Central Medicare or ourselves, and we can help you. It's free, it's confidential, and we'll help you figure out what the deal is and whether it's something that needs to be investigated or not. So you're the first line of defense. Please pay attention to this. Again, we're the SHIP office, State Health Insurance Assistance Program, as well as Central Senior Medicare Patrol. And this is our number. If you would like to meet with us, or if you want us to send you out any of the books and things like that we have on hand, you can give us a call. We'll set up an appointment. No cost to you, and we're here to help. So we hope we hear from you. I spoke earlier in the discussion about the IRMA program, the income-related Medicare adjustment amount. If you look at this chart, if you look at your, first, do you file individually, jointly, or married and separate? Once you've figured out how your tax return goes in, if you look down at the gross amounts that your income is, then you can determine by looking all the way to the right-hand side of this chart what you would pay monthly. So for Medicare Part D, you would pay if you make more than that 91,000 as an individual, or filing jointly 182,000, then you would pay your plan premium, whatever that plan is for that Part D. If you make more than that, depending on what you make, you could pay up to $77.90 plus your plan premium. Your income also on your monthly Part B can be adjusted for your income. Same way you read the table. The difference is, if you look at the right-hand column, the people that fall in that first category are going to pay the standard $170.10 a month. As you can see, you could pay up to $578.30 a month if you're above certain amounts. So this is just to make you aware of those. And if you have questions, you can obviously contact us at the 410-386-3800 number. And this was part 1, talking about your enrollment, etc. Part 2 is really focused on looking at Medigap versus Medicare Advantage, where we'll get into some of the costing on both. So we hope you join us for that, and thanks for joining us. Take care.